Hello friends, let us now learn some important points about obsessive compulsive disorder. So in the obsessive compulsive disorder, first we have obsessions. First, in the obsessive compulsive disorder, in the beginning there are obsessions which will form thoughts, and these thoughts will result in act, that is compulsion. So obsessions are recurrent intrusive thoughts. They are recurrent intrusive thoughts, impulses, and these include anxiety or distress. So these are recurrent inclusive thoughts and impulses which will cause anxiety and distress. They are the products of their own mind, and the patient knows that these thoughts are senseless, but still he could not um, get away with those thoughts. So these are ego dystronic, that is, these thoughts are unwanted and unacceptable, but still the patient attempts to resist these thoughts, but he could not do it, and as a result he will do the compulsions. That is, compulsions are repetitive behavior or the mental act that is in accordance to the obsessions. So I will tell you an example, then you will understand. So for example, if we have if the patient has the thought that his hands are dirty, then that thought is always recurrent in the patient, and that thought is that thought of hands being dirty are um, are the products of that patient's mind itself, and the patient knows that his hands are clean, and this thought is senseless, it's not a proper thought, but still that patient could not help him not getting that thought. Not only that, he could not help himself from resisting him from washing the hands. So he tries to resist the thought, but still that thought of his hands being dirty, that thought will be in his mind again and again. So then he goes and he washes his hands, and that is the repetitive behavior that he does. So if you see, these are the example that is how the obsessive compulsive disorder is. So for example, this is done for different diseases. We have obsessive compulsive disorder: 1, dirt and contamination; 2, doubt; 3, symmetry, that is the patient starts arranging everything in his room in a symmetrical way, and the compulsions are checking and washing. If he has a doubt of closing the door, he goes again and again and checks whether he has closed the door properly or not. So the prevalence of obsessive compulsive disorder is seen in 2 to 3%. If symptoms are present at least for 2 weeks, then it is obsessive compulsive disorder. Most common comorbidity in obsessive compulsive disorder is depression. So etiology, the most common etiology is serotonin dysregulation is the most common etiology. Sometimes it also causes dysregulation of noradrenaline is seen sometimes. The model of this obsessive compulsive disorder is role of corticostriatal thalamic cortical circulatory system is the model. That means here there is the prefrontal cortex. The impulses from prefrontal cortex travel to the striatum. From there they travel to the thalamus, and from there the impulses travel back to the cortex. This is how the impulses pass in obsessive compulsive disorder. So symptoms, if you see, if there is obsession of contamination, then the compulsion will be washing. Then if the patient has pathological doubt, he goes and continuously he checks the door or checking. If he has symmetry or precision has obsession, then he is very slow in doing his work. If there are any intrusive thoughts, obviously there will be no compulsion for it. Now if you see the course of disease, 50% of these patients land themselves in chronic disease. 20 to 30% will progress to improvement, whereas 40 to 50% they undergo moderate improvement, whereas 20 to 40% there will be no improvement. Then if you see the differential diagnosis, obsessive compulsive disorder and delusion is the differential diagnosis. Obsessive compulsive disorder is ego dystronic, whereas delusion is ego syntronic. In obsessive compulsive disorder, the patient does not want the thought and he does not accept it. But in delusion, he wants the thought. He is accepting it. He believes it so hard that whatever you do, his thought does not go away from him. Right? Now, if you see the treatment, in the treatment of obsessive compulsive disorder, first treatment of choice for obsessive compulsive disorder is behavioral therapy. Then in this, first drug of choice for obsessive compulsive disorder is selective serotonin reuptake inhibitors, followed by benzodiazepines, followed by tricyclic antidepressants. Drug of choice for OCDs is fluoxamine, followed by fluoxetine, followed by clomipramine is the drug of choice for OCD. Then if you see, the treatment of resistant obsessive compulsive disorder is also important. Even after giving the treatment, if obsessive compulsive disorder does not resolve, then it is resistant obsessive compulsive disorder. The treatment of it is, we give IV clomipramine, RTMS, that is repetitive transcranial magnetic stimulation, is done for obsessive compulsive disorder, post-traumatic stress disorder and depression. Deep brain stimulation test is also done by placing microelectrodes in the brain. Examples are this deep brain stimulation is also done, for example, in obsessive compulsive disorder and Parkinsonism. Then we can also do psychosurgery, that is cingulotomy can be done for resistant obsessive compulsive disorder. The scientist Moniz has done this cingulotomy, and for that he is given Nobel Prize in 1936. Then we have behavioral therapy. In the behavioral therapy, one, we have exposure and response prevention is done. In exposure and response prevention, you will have to ask the person to get exposed to his obsession. Like, he always feels that his hands are dirty, right? So he will get exposed to that dirt, and he will have to stop himself from washing. So that is slowly we will increase the amount of stimulus, and we will ask the person to become habituated with the obsession and stopping the compulsion. So this will improve by principle of habituation. Then second, if there are pure obsessions, in pure obsessions we will have to stop the thoughts, that is thought stopping, or we have to do thought flooding. In thought flooding, if there are only obsessions, then the patient has to record all such thoughts in the patient's own voice and listen for 4 hours a day. In such cases, the patient feels bad for himself and he will stop thoughts slowly. Then third is cognitive brain therapy. In cognitive brain therapy, here the faulty cognition will result in undue and excessive sense of responsibility. So here the false cognition will result in undue and excessive sense of responsibility. So this is about the obsessive compulsive disorder. Thank you for watching.